Good evening, and it's great to have you with us as we start another week together. And we're going to begin tonight with that extraordinary moment that played out just a short time ago. President Trump has left Walter Reed Medical Center after being taken there Friday night. He has now returned to the White House tonight, where he continues to battle coronavirus. This was the scene moments ago in Bethesda, Maryland. The president walking down the steps, 6:38 p.m. Eastern, wearing a mask, something we did not see him often do before being diagnosed. At times he did. But now wearing that mask as he waved to the cameras, a thumbs up to the cameras. You heard him say at one point, "Thank you very much." He did not take any questions. Then the extraordinary moment, the motorcade driving him to Marine One. Obviously, we have never seen this before as this country deals with a pandemic. Marine One waiting for him as the president now treated for coronavirus. 2 experimental treatments at Walter Reed, also a powerful steroid, the supplemental oxygen, and then that short flight on Marine One that took him across from Bethesda, Maryland, back to Washington, D.C., to the White House, where they will take close watch. Doctors acknowledging today that they will be on guard at least through next weekend, given the course of this. Earlier today, his medical team coming before the cameras, they treated the president aggressively with a variety of medications, as I mentioned, some experimental, along with that powerful steroid, and the president's doctor confirming that the president did receive that oxygen twice since testing positive for COVID. The president's doctor saying late today he may not be entirely out of the woods yet. In fact, the doctor said we won't know for several days from now truly how the president is faring, given the normal course of the virus that we have seen millions of Americans fight. Tonight, the president back at the White House at this hour, and this evening the number growing. At least 18 people now connected to the president have tested positive, 11 of them at that Rose Garden event, including introducing Judge Amy Coney Barrett. She does not have coronavirus from this, but several people who were at the Rose Garden have come down with it. Among them, top aide Hope Hicks, Kellyanne Conway, Governor Chris Christie, 3 senators. And just today we learned more. We learned that Press Secretary Kayleigh McEnany and 2 members of her staff in the West Wing have now tested positive. The president tweeting today about leaving Walter Reed, telling the American people, don't be afraid of COVID, don't let it dominate your life. A true outrage from many who point out this country just today hit 210,000 lives lost, and that the president received the best health care in the world, those experimental treatments. Many upset with him saying, don't be afraid of COVID. We begin with our chief White House correspondent, Jonathan Karl, tonight with the breaking news.
After receiving some of the most advanced medical care in the world for 3 nights, including experimental treatments usually reserved for the most serious COVID cases, President Trump headed home to the White House. His message to Americans, don't be afraid of COVID. Don't let it dominate your life. He added, I feel better than I did 20 years ago. The president's doctor says he gave the all clear to go home.
Though he may not entirely be out of the woods yet, the team and I agree that all our evaluations, and most importantly, his clinical status, support the president's safe return home, where he'll be surrounded by world-class medical care 24/7.
So how is the president really doing? It's been nearly impossible to discern amidst a series of false or conflicting statements from the White House and the president's physician, Dr. Sean Conley, over the past 4 days. Once again today, Dr. Conley refused to answer basic questions about the president's health.
Or any inflammation in his lungs at all?
So we've done routine standard imaging. I'm just not at liberty to discuss.
On Saturday, Dr. Conley insisted the president was doing just fine.
This morning, the president is doing very well. The team and I are extremely happy with the progress the president has made.
He falsely told reporters the president had not been given oxygen, when in fact he had been given it twice.
Yesterday and today, he was not on oxygen. None at this moment. Yeah, and yesterday with the team, while we were all here, he was not on oxygen.
Minutes after that briefing ended, White House Chief of Staff Mark Meadows pulled reporters off to the side.
If we can go off the record with some of y'all and get away from the cameras.
Sure.
Meadows then directly contradicted the doctor, saying, quote, the president's vitals over the last 24 hours were very concerning, and the next 48 hours will be critical in terms of his care. We are still not on a clear path to a full recovery. Sunday, as Meadows looked on, his head in his hands, Dr. Conley admitted he had not told the truth about whether the president had been given oxygen. He acknowledged he was putting a positive spin on everything to please the patient.
I was trying to reflect the upbeat attitude that the team, the president, that his course of illness has had. didn't want to give any information that might steer the course of illness in another direction, and in doing so, it came off that we were trying to hide something, which wasn't necessarily true, so here I have it.
Over the course of his hospitalization, the president staged a series of photo ops designed to project strength and to prove he was still on the job. In this photo, the president appears to be signing his name to a blank piece of paper. Yesterday, the president had the Secret Service drive him outside the hospital so he could wave to the cameras and to his supporters, possibly exposing the agents riding along with him to the virus. The move outraged Dr. James Phillips, an attending doctor at Walter Reed, who tweeted all those agents must now quarantine, adding they might get sick, they might die for political theater. Commanded by Trump to put their lives at risk for theater. This is insanity. Dr. Phillips appeared today on GMA.
I don't know what the benefits of this political stunt were, but I do know what the risks were. And my concern is that perhaps the Secret Service agents that were inside don't know the full risk of what they were up against there and what the real threats were.
Tonight, the president returns to a White House thrown into chaos by COVID-19. Each day, more staffers getting sick. Today, Press Secretary Kayleigh McEnany announced she too has tested positive for the virus. For days, she has been speaking to reporters without wearing a mask, even though she has had extensive contact with both the president and with Hope Hicks, who tested positive last Thursday. 2 of McEnany's aides in the White House press office have also tested positive. In total, 18 people who were around the White House and President Trump now have COVID-19. 11 of them attended the Rose Garden ceremony where the president announced his Supreme Court pick. Others, including Hicks, former New Jersey Governor Chris Christie, and Trump campaign manager Bill Stepien, attended a debate prep meeting at the White House. The president's daughter, Ivanka Trump, has tested negative. At the debate in Cleveland, she didn't wear a mask. Over the weekend, she was recorded by the Daily Mail jogging with her husband, Jared Kushner, in their Washington neighborhood, both now wearing face coverings. Multiple sources tell ABC News there is now what one person close to the president called a full-blown freakout among the White House staff. New York Times reporter Michael Shear, who tested positive after flying on Air Force One a week ago Saturday, says no one has reached out to him to trace his possible contacts.
White House. Nobody from the White House has said boo and asked anything about where I was or who I talked to or who else I might have infected.
There are also serious questions about why the president traveled to a fundraiser in New Jersey on Thursday after learning Hope Hicks had the virus. New Jersey officials are now tracing the contacts of more than 200 people who were there with the president. Sources tell ABC News the president tested positive shortly after he returned from that trip. But hours later, he told Sean Hannity he was still waiting on results.
So I just went for a test, and we'll see what happens. I mean, who knows?
Today, his doctor refused to say when the president last tested negative for the virus.
I don't want to go backwards.
As for the president, 7 months into a crisis that has unfolded on his watch, he now says personal experience has taught him a lot about a disease that has killed more than 210,000 Americans.
It's been a very interesting journey. I learned a lot about COVID. I learned it by really going to school. This is the real school. This isn't the let's read the book school. And I get it, and I understand it, and it's a very interesting thing, and I'm going to be letting you know about it.
John Carl with us live tonight from Walter Reed. And John, I just want to show the audience the images just coming in as we're on the air tonight. This is the president coming off of Marine One at the White House just moments ago, wearing the mask, a wave, a salute as he makes his way back to the White House. Obviously, this comes after 3 days of treatment at Walter Reed, waving to the cameras. He did not answer questions. Heading back into the White House where he is expected to say, and John, as you heard from Dr. Conley late today, his doctor, there's the thumbs up, the customary thumbs up from President Trump, but you heard Dr. Conley say, John, that we are still on guard given where we are in the course of this. We won't know, Dr. Conley said, at least until next weekend.
And for the time being, although the president is back at the White House, David, he will be confined to the White House residence where he will continue to have very top-level medical treatment, but he'll be confined to the residence. That means no Oval Office, no West Wing. The White House insists that during this time, though, that he will continue to work, and the Trump campaign has put out word that he has every intention to participate in his next debate with Joe Biden, although they don't rule out the possibility that could be a virtual debate.
And there you see it, John, not only with the horns behind you at Walter Reed, but the president at the White House there taking off his mask. He has arrived back at the White House. He will head into the residence where he'll be working. His team will be watching him closely there. And as you heard John just mention, the president already signaling this evening that he plans to be back out on that campaign trail soon. He also, according to the campaign, plans to be at the next debate on that stage with Joe Biden, something that Dr. Connolly was asked about late today and said, we'll just have to see. This president, several days into this, though we don't know for sure when this began, because we don't have a firm timeline. And the last time President Trump tested negative for the virus, all we know is that he tested positive sometime Thursday evening. So still relatively early, as we've done so much reporting on Americans facing coronavirus in this country. I do want to bring in Dr. Ashish Jha. He's the dean of the Brown University School of Public Health. And Dr. Jha, first of all, thanks for being with us every step of the way on this. I want to get right to what we heard from the president's doctor today. Dr. Connolly said we all must remain cautiously optimistic and on guard when it comes to a patient who has received the therapies that the president has received. And so early in the course of this, he said, we are looking to this coming weekend, which you and I know is several days from now. He seemed to be acknowledging that we are still very early in this, given the course of coronavirus that we have seen in the millions of people who have battled this virus.
Yeah, so David, thank you for having me on. Indeed, the president is not out of the woods. Thankfully, he's doing better, it appears. But the bottom line is that we know that in the course of this disease, some people take a turn for the worse 5, 7, or 10 days after their diagnosis or their symptom onset. So depending on when it all happened, the timeline is still unclear, probably looking to this weekend before I think we can sigh a sense of relief that the president is out of the woods.
And Dr. Jha, we know the president received those 2 experimental treatments, the antibody cocktail, remdesivir, in addition to a powerful steroid earlier than many patients would have. Obviously, we would expect that in this country. He is the president of the United States, has access to the best health care. But I wanted to ask you about something Dr. Connolly was asked about late today. He did confirm the president received supplemental oxygen twice, but it was this question. He was pressed about the president's lungs, if there was any pneumonia or any inflammation in his lungs at all, what they might have seen in the imaging. He said, I'm not at liberty to discuss, but that, quite frankly, Dr. Jha, would have told us a lot more about the president's condition in this.
Absolutely. So the main way people get very sick or even die from this disease is damage to the lungs. And we suspect that the president has had some damage to the lungs. But Dr. Connolly has been very cagey about this. And it's odd that he won't share that information when he's been willing to share much more detailed information. And I think it raises certainly a lot more questions than answers about the health of the president.
Dr. Ashish Jha with us again tonight.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.